We can all appreciate the valuable impact of frontline NHS staff, but what about data analysts behind the scenes, producing health intelligence that guides and informs where care is given? Nottingham and Nottinghamshire ICS believes analytics play a vital role in supporting the NHS now and ensuring it has a bright and strong future.
Whether it's organising NHS resources at the height of winter pressures or predicting health risks in communities, population health management is about both treatment and prevention.
And key to driving better care is having the right data. That's certainly what a team of analysts here at Nottingham and Nottinghamshire's integrated care system believe. In fact, it's almost 2 years since a special unit was set up to try to identify high-risk populations and future health needs.
The System Analytics Intelligence Unit interprets data not just from the NHS, but for the first time also from local authorities and other public bodies. Chief Executive Amanda Sullivan says as a result, the team are able to build a detailed picture of what the health needs are and how to provide the right services.
Population health management is us understanding what the health needs of our population are, both now but also into the future, and then making sure that the resources we have in the NHS are targeted to the areas where there is most need and where we can prevent ill health or where we can stop it getting any worse. And then we monitor the impacts of those as well. The data is critical to enable us to make those decisions.
During the pandemic, the work of analysts here gained prominence, and in particular how they helped ensure all communities had access to the vaccine.
We had the data to tell us exactly where the uptake was really high and where it was low and where people were more vulnerable to COVID. And we targeted a lot of effort in those areas. So we worked with local communities, we worked with community leaders, faith groups, councils, and we were able to literally target street by street and make sure that people did have the offer of the vaccine and it wasn't a problem with accessing the vaccine.
Over the last year, analysts have looked at fuel poverty and how to help those most at risk. Medical Director David Briggs says the work of the team has gone way beyond just healthcare.
This is not just a health database, this is health, social care, local authority and public health. And what that does, it gives you a really good picture of levels of deprivation, quality of housing, known problems with health outcomes, which also tells us what sorts of conditions, age, and other impacts on healthcare that might have. When you put that picture together, you can find groups of people across the county and the city who are most vulnerable to having a cold home, and you can very specifically offer them and reach out to them what sort of services are available.
But what about data privacy? Dr. Cathy McLean is the ICB chair.
We ensure that information is anonymised for when it's aggregated. Obviously, you need to do that, and so individuals' own information is used for their own care. But by anonymising, we can get a picture, if you like, of a community or an area, a place within our system. But I think we're also trying to involve people in determining how they want care to be provided and how they want to be helped in order not to get ill.
The team have created a portal where all the data is available for those working across the integrated care system. That collaboration is something many of the analysts here are proud of.
Building relationships and collaborating with people has been really rewarding, and we've able to, through that collaboration, I think we've been able to create some amazing products like the Health Inequalities Dashboard is a resource for everyone in the system to use to understand health inequalities, and that was built collaboratively.
It is a privilege and an honour to be part of the system and to be able to give my very, very small contribution to the health of the local communities.
It may feel like a small contribution, but many here believe the work of analysts is the backbone of the NHS, making sure care is delivered in the right places and at the right time.